Hi, welcome to the Uncarved Block. In this episode, we are going to look at a call-in show hosted by Jovan, Bradley, and Arden Hart. Or is it Arden L? I don't know. So we're going to look into a call-in show with those two hosting. This poor guy calls in, and you can't fault them for having a bit of fun with him because he doesn't seem, he's not that coherent in his responses. And he doesn't seem well educated on the matters he's addressing. But you will see the hypocrisy expressed by these two in that Jovan will happily insult Christianity, but when somebody insults such things as trans issues, that's not okay. And they will address some medical things, which I call out. Jovan seems to think that sperm is not produced in the ball sack. Huh, interesting. What's in the ball sack? The testes. What did the testes produce? And I'll show evidence of that just for anybody that does not know that. But Jovan doesn't seem to know that. If you watch this and you're a fan of his, let him know, and maybe he needs to make a correction. All right, let's get into it. Please enjoy.
How do you start a conversation with just saying something terrible, man? Like you say, hey, let's have a debate, and it just says Christianity is terrible.
Yes, that's
you just shout on like 300 million people, you know?
I'll shit on 300 million more too. I don't give a fuck. Those are my takes. So my take is Christianity is terrible, and then it's a debate. So if somebody wants to debate me,
I wonder how Jovan feels about shitting on trans people like Arden. Or just in general.
Would take the opposing side to this, which is Christianity is not terrible, and then we would debate about it. If you'd like to debate, before we can get started, I need your name, age, and pronouns.
Gotta have the pronouns. I'll explode if I don't get pronouns, or I'll throw a hissy fit and go, why don't you just use pronouns?
But so if a trans kid has severe gender dysphoria, which can possibly be life-threatening, they can't change their biology, but your wife could.
No, because it's not life-threatening. You can say, oh, they hate themselves and they want to commit suicide. That's a mental thing. That is a mental issue.
Issues aren't life-threatening?
That person needs the help of, and I'm not saying send them to a psychiatrist.
Are all mental issues life-threatening? Wouldn't that be the question you would ask if it were flipped?
I'm against therapy of psychiatrists and all that.
Oh my God.
But what I'm saying is a family support group.
Casey, why should anyone care what you have to say about anything medical ever? Because you're really just kind of being like, I don't understand how anything works, but I just don't think people should have medicine in this way.
Why should anyone care what these two goobers think?
It's like, why should anyone care?
Really on anything else.
You're chemically castrating men and women.
It's not chemically castrating. First of all, this medication has been given to cis people. This medication.
Oh, really, Arden? You are such a fibber. NHS UK. Gender dysphoria / treatment. I'm sure you can search for it. Gender affirming hormones alongside psychosocial and psychological support. These hormones cause some irreversible changes, such as breast development, caused by taking estrogen, breaking or deepening the voice, caused by taking testosterone. Long-term gender-affirming hormone treatment may cause temporary or even permanent infertility. Risk of hormone therapy. The most common risks or side effects include blood clots, gallstones, weight gain, acne, dyslipidemia, abnormal levels of fat in the blood, elevated liver enzymes, polycythemia, high concentration of blood clot cells, hair loss or balding, androgenic alopecia. There are other risks if you're taking hormones bought off the internet or from unregulated sources. Long-term cross-sex hormone treatment may also lead eventually to infertility, even if treatment is stopped. Why should anyone take their word on these things when they obviously don't know what they're talking about?
Given to cis people for the same reasons for decades and decades.
Okay, real quick.
No, they're not given to cis people for the same reasons.
Hold on, Arden. Let's just hey, Casey, can you provide me a functioning definition for what castration is? Like, what is castration?
Castrate? Well, do you want chemical castration or physical castration?
Whichever one you want to give me.
Can either of these two guys, literally guys, provide me a functional definition of male and female?
Okay, well, physical would be to literally take the organs out of the body through surgery or things like that. Chemically, they give you chemicals that make you sterile. You will either not be able to produce children through your ball sack or through ovaries. They'll quit producing eggs. They chemically castrate
Oh
you
my
to where you still have the organs, but they don't function. Like, why should a boy grow boobs? That is not okay. See, a man has nipples because in the womb,
Oh my God.
the body hasn't turned you
Is
into
your
a boy.
brain made of like margarine?
When you're
I'm
first
just
born,
curious.
you're a human, but you're not a male or a female until a certain point into the pregnancy.
Arden's a theater nerd. He's one to talk.
That's why men have nipples, not tits. So if you put tits on a man through chemicals, or on a child especially, you're destroying those hormones. Those people aren't fully mentally developed. Women until I think 25, and men, I'm convinced we say kids our whole life in some ways, but mentally.
Okay. Do you mind, Casey, if I correct some of the scientific inaccuracies that you just said? There was quite a few of them.
Oh, I can't wait for this.
No problem. Like I said, I'm not a doctor. I don't know that stuff 100%.
Okay.
But yeah.
So now correct me if
Neither's Jordan.
I'm wrong, but I
Jovan.
believe I heard you say that sperm is developed in the ball sack.
Well, no. That's just where it goes before you let it out. It's not created in the ball sack.
Okay.
But that was just a slip in my words. I'm not the smartest guy in the world, and I'm not the most composed speaker. So if I do say something that's a little off, then and you correct me, that's fine. I can reiterate it.
All right. Secondly, you've made.
Oh, wait. I thought you were going to go with things that were factually correct, Jovan, because it's factually correct that the testes produce sperm. Yet you just agree with that guy. Wow. Why should anyone take the word of either of these guys on medical issues?
These claims that gender affirming care is chemical castration that is going to leave children sterile. Can you provide me the percentage of people who undergo, I don't know which gender affirming treatment you're talking about. I'm going to assume you're speaking about hormone therapy because pubertal suppressants don't lead to sterility in any statistical significant way. So can you tell me, when it comes to, again, I'm assuming you're talking about hormone therapy, what is the percentage of people who undergo this treatment that end up sterile?
So is it only the percentage that matters? Because I can nail you on that.
Well, as far as I'm concerned, they're getting it to become sterile, are they not? In certain hormone therapies, I'm not saying all of them, and I'm not saying that all people who are transitioning use them. They don't. Not everybody uses them, so I don't know a percentage. I should answer your question.
Go ahead, Arden.
I don't honestly know a percentage.
No, I don't have a whole lot to offer here. Nobody is getting hormone therapy to be.
Well, I got to agree with him there. I mean, no one is getting it to be, but they should understand that will be a consequence.
Become sterile. It is a consequence of some forms of hormone therapy. As Jovan is pointing out, puberty blockers don't do that, but there are lots of drugs that cause sterility that we commonly have to give to children. For example, chemotherapy.
Oh my gosh, they're conflating chemotherapy with wanting to say you're a man or a woman. Oh my gosh, that is disgusting, Arden.
And you're
you're not a
misinterpreting my
doctor
point.
because I'm saying
Massively.
bullshit. Can you speak properly?
There was no assert.
I
She was
don't know
making
to
a
talk to the guy.
comparison.
The guy seems pretty grounded. The guy seems
You're already talking to a guy.
real grounded, and we disagree, but he was respectful and he seems grounded. So maybe you should let him talk more.
Let me
Because I
just,
feel a
can I
little
just ask you,
disrespected. I show people respect.
I just need to know really quickly, and I think this will help me understand where you're coming from, Casey. Do you believe trans people to be the gender that they say they are?
What is gender?
No, but do I believe that they think that they are the gender?
There is nothing wrong with that position, Jovan and Arden.
That they believe. I do believe that they believe that, but I do not believe that that is correct.
Okay, so
Oh my gosh, walks like a guy, because He is one.
Like, if you met a trans woman, right, you would.
Which I have. I know a trans man that she would like to be called she now, and I don't believe it, but I respect the pronouns. I'm not going to disrespect anybody. You know, he was a boy and he transitioned into a girl.
Okay, so let me just confirm, you don't believe trans women are women, and you would know, right? If you met one, you would know, like, that's not a woman.
Yeah, usually. You can tell Arden's a man.
In order for me to not come off as
you said,
what's the word I'm looking for? I don't want to come off as what's the word I'm looking for here?
I could relate. I have a hard time thinking of words.
I don't want to use Arden as a prop, so I'm gonna back off of this argument unless Arden decides she wants to go forward with this argument.
No.
Oh,
go full steam ahead. Honestly, I've got nothing, and this is gold. So just
okay.
You know, make it worth it.
Okay. In fact, here's a better question, Casey. Am I trans?
Well, I only saw your head, and shoulders, but you very well could be, but I wouldn't know. No.
Who cares? Who cares if you're trans, Jovan? You're a man.
I would say you look generally more like a man than a woman.
What about Arden?
Arden?
Yeah.
She got that deep voice, but I would for sure say that she's a woman.
I have an uncommon video where I demonstrate that one of these trans-identified men that thinks they pass do not, and it's hilarious that they were pegged. But here's the thing. Where is this guy viewing this? Is it on a big screen TV? Is it on his phone? Is he even really paying attention if it's on his phone that much to the video? So, you know, they're playing this little game, and as he said, you can only see his head and shoulders, and that's not much to go on. He did, however, notice Arden's deep voice. That's a dead giveaway. And if you saw Arden in public, which I have on record people that have seen him out in public, you can peg that Arden's a guy. And so, yeah, this little game they're playing with minimal information to go on is disingenuous.
Do you know how gender dysphoria is diagnosed in the United States?
Yeah, you go to one doctor and they say, hey, you got gender dysphoria, and that's it.
No, I can't say that I do.
Okay. So the reason, in my opinion, that you think that it can be coerced so much is because you don't know how gender affirming care is or gender dysphoria is diagnosed. We've gotten to a point pretty concisely with gender affirming care that it's really hard to trick a doctor that you might have gender dysphoria. I won't say trick. It's really hard to convince a doctor that you might have gender dysphoria if you don't. That you might be diagnosed gender dysphoria. Because let me change the phrase. Because anybody can have gender dysphoria, right? Whether you're trans or not. But in order to get diagnosed.
And anybody can say that as well.
But again, when it comes to diagnosing someone, you require 6 months of therapeutic counseling before you can even get a diagnosis.
After having believed I could not find happiness as a woman for over 15 years, I eventually medicalized at 28 years old. All it took was one phone call to Planned Parenthood to get hormones. Shortly after starting testosterone, I experienced edema, weight gain, persistent nausea, and most notably, a rapid and dramatic voice change, resulting in permanent throat pain. I was a professional singer prior to starting testosterone, and within 3 months, I was no longer able to perform.
Okay, so here you are, 8 months in that space, and then how did you start to do the actual physical? Did you start a physical transition, like taking hormones?
Okay. So I made an appointment when I was still 17 at this informed consent clinic. It was during COVID. So the day after I turned 18, I had an online appointment. Okay. And that same day, I had a prescription for estrogen, oral estrogen.
Online?
Yeah, online. I think you.
So around the end of my 19th year of life, I decided to go on testosterone. I went to a handful of visits with a counselor, and the counselor wrote me a note to an endocrinologist saying that I had dysphoria and that I should go on hormones. So I went to this endocrinologist, is that how you say it? In Tulsa, Oklahoma, and I got my first prescription for T. The first visit that I went to the endocrinologist is when I got my testosterone.
Now, the medical transition very quickly progressed. Just a few months after I started seeing therapy was when I was given the prescriptions for my first few treatments, the puberty blockers and testosterone. I received my first doses of both at the age of 13, before I had even finished middle school.
You would know that gender affirming care for those children that are diagnosed is actually really good because it's treating something that can be very severe and can lead to suicidal ideations, self-harm, and a whole litany of other things.
What is the percentage of that, Jovan? I thought if it's a small percentage of people becoming infertile, we really don't worry about it because that's just a small percentage. And Jovan here, this YouTube goofball, somehow knows that it's high percentage when the lawyers for the ACLU before the Supreme Court of the United States could not present that evidence. Jovan needs to contact them and give them this evidence because they didn't have it. Gosh, oh man, I hate that these YouTube people know more than these ACLU lawyers. It just fires me up.
But see, my issue with that is, I mean, the numbers for after the transition and before transition, the suicide numbers are very similar.
They are not. What we tend to see in gender affirming care is a 70% drop in suicidal ideations when you receive medical affirming care that is coupled with support.
Why didn't the ACLU present this to the Supreme Court?
The studies that quote that the rates stay the same are never analyzing pre and post transition. They analyze trans suicide rates to the general population suicide rates.
Why didn't the Supreme Court know all this?
Oh, so it's just the amount that have done that.
No, it would be like analyzing a trans person to me, right? Like that doesn't tell me anything about whether their rates decrease before or after. Typically, we see about a 70% drop in suicidality when they're given adequate gender affirming care and adequate support after the fact.
Maybe if they just got adequate support, but not the gender affirming care, the ideation would still be low. Again, Jovan needs to contact the ACLU. Let them know all this evidence he has. I think the biggest issue when we search these things is that there is a lack of evidence. For example, Karger.com, Hormone Research in Pediatrics, Use of Gonadotropin Releasing Hormone Analogs in Children, update by an international consortium. And what they state in this abstract is although there have been many significant changes in usage, there is a definite paucity of evidence-based publications to support them. And notice how Jovan seems to have access to far more these evidence publications than these doctors do. What Jovan, Arden, and people like them attempt to do is overly associate the thoughts of unaliving with the act of unaliving. And in fact, what we see is that they were unable to demonstrate that there was evidence that such procedures really do reduce unaliving. Justice Samuel Alito cited the Cass report from the UK, which was a very broad survey. Many TRAs will say that it's been debunked, but somehow the ACLU lawyers did not know that it had been debunked, and they were not able to present evidence that it had been debunked. Interesting that. As a journalist in Manhattan Institute fellow Leo Sapir documents for City Journal, what followed was a clear admission from Strangio. What I think that is referring to is there no evidence in the studies that this treatment reduces completed unaliving. And the reason for that is completed unaliving, thankfully and admittedly, is rare, and we're talking about a very small population of individuals with studies that don't necessarily have completed unalivings within them. Didn't Jovan say something about statistically insignificant? Strangio admits under oath that unaliving is actually rare. Strangio's use of admittedly is also striking, as it suggests the attorney is aware that claims about unalive prevention through sex change are false. Strangeo's argument was the startling admission before the highest court in the land. Multiple studies have shown that gender transition procedures do not decrease unaliving risk. For instance, a Finnish study published in the Journal of BMJ Mental Health found that a clinical gender dysphoria does not appear to be predictive of all-cause nor unaliving mortality when psychiatric treatment history is accounted for. The study's authors revealed that the all-cause mortality rate among patients struggling with gender dysphoria was much lower than reported in earlier studies among adults diagnosed with gender dysphoria. Those struggling with gender dysphoria need help identifying the root causes of the distress, not harmful procedures. In fact, as Dr. Cantor writes in his report, and I may look at that in a second, it is repeatedly asserted that despite the known risk, despite the lack of research into the reality or severity of unquantified risk, it is essential and the only ethical response to provide medical transition to minors because medical transition is known to reduce the likelihood of unaliving among minors who suffer from gender dysphoria. This is simply untrue. No studies have documented any reduction in unaliving rates in minors or any population as a result of medical transition. No methodological sound studies have provided meaningful evidence that medical transition reduces suicide unaliving in minors. Instead, multiple studies show that tragically high rates of unaliving after medical transition, with that rate beginning to spike several years after medical transition. Thus, according to Dr. Cantor, gender transition drugs and procedures not only fail to decrease the risk of unaliving, they may actually increase it. Unlike Jovan, Arden, and me, Dr. James Cantor is actually a doctor. He's a sexual behavior scientist. He has published over 50 peer-reviewed articles in his field. As a clinical psychologist and neuroscientist, he has held positions for the Center of Addiction and Mental Health as senior scientist and psychologist, as well as head of research for CAM's Sexual Behavior Clinic. For 15 years, he was editor-in-chief of the peer-reviewed journal Sexual Abuse. He has also served on editorial boards of the Journal of SMEX Research and Archives of Sexual Behavior and this Journal of Sexual Aggression. In 2022, he was awarded the Distinguished Contribution Award from the Association for the Treatment and Prevention of Sexual Abuse. It's amazing that Jovan and Arden know more than this guy. What are his summaries? International institutions have reversed course on medical transitions for minors. Healthcare institutions in England, Finland, Sweden, France, and Norway point to the experimental nature of these procedures and uniformly concluded that the data, especially the long-term effects, is inconclusive and insufficient. Yet Jovan knows that this is all conclusive and sufficient. Puberty blockers and cross-sex hormones are not safe or reversible. This claim is unsupported by any substantial scientific evidence. Again, Jovan, get your scientific evidence now to the ACLU. Puberty blockers and cross-sex hormones already carry known and potential risk. Jovan says no. Sterilization, loss of capacity to breastfeed, loss of sexual functionality and pleasure, interference with neurodevelopment and cognitive development, delayed puberty associated with medical harms, elevated risk of Parkinson's disease, reduced bone density, other side effects, such as sterile abscesses, leg pain, headaches, mood swings, weight gain, tiredness, hot flushes, low mood and anxiety, etc. Lifetime medical care. Yeah, that's a big thing right there. Lifetime medical care. You are setting them up to permanently be on lifetime medical care. And what does many in the medical industry want? Money. Medical transition of minors has no reliably proven mental health benefits. Plainly states, Dr. Cantor says, no studies have documented any reduction in unaliving rates in minors or any populations. I've already read that. Studies from Sweden and Netherlands and United Kingdom showed that rates of suicide still remained extremely elevated, 5 to 9 times higher, or were not reduced post-transition. Even WPATH, who is very favorable to trans issues, when judging the effectiveness of puberty blockers and cross-sex hormones, admitted that it was impossible to draw conclusions about the effects of either hormone therapy on death by unaliving. This evidence does not support suicidality, ideation, threats, and gestures being reduced by transition. One study even found that minors receiving hormone treatment showed increases in each of suicide ideation from 25 to 38%, attempts from 2% to 5%, and non-unaliving self-injury, 10% to 17%. In addition, some research has found that social support to be associated with increased unaliving attempts, suggesting the reported suicidality may represent attempts to evoke more support. Oh, we could go on. Minors with gender dysphoria tend to struggle with other mental health issues. Most young children with gender dysphoria will become comfortable with their sex desist after puberty, i.e., they will probably just be gay. And by the way, Dr. Cantor is gay, if that matters. The exception, in part, of the Endocrine Society, this suggestion that U.S. medical societies examine the relevant scientific evidence in a similar way to Dr. Cass is, however, wholly false. The Cass review is based in part on a half dozen systematic literature reviews, the gold standard of scientific evidence, of the evidence which concluded that the science was wanting and uncertain. Major medical societies such as the American Medical Association or the American Academy of Pediatrics have been out front backing pediatric gender medicine, have conducted no such reviews. The AAP claimed in August 2023 that it was going to commission a review, but there is yet no evidence that they've even started. The Endocrine Society's current treatment guidelines did rely on 2 systematic reviews, but they only concerned 2 specific health risks and did not examine the potential benefits of treatment. Regarding unaliving ideation, unaliving thoughts, it's from the Cleveland Clinic, Care and Treatment. How is unaliving ideation treated? Treatment for unaliving ideation varies based on severity and likely cause. One goal of treatment is to keep you safe. Your healthcare provider might recommend one or more of the combination of the following as treatment. A safety plan that includes coping skills. Why don't we teach these kids coping skills? Cognitive behavioral therapy and other therapies to strengthen coping skills. Medications. This would be where Jovan places too much emphasis, I think. Inpatient or outpatient mental health programs with hospital clinic. You can't prevent your brain from thinking thoughts, so there isn't a way to prevent ideation. But there are ways to make thoughts less severe and prevent unaliving. Education and learning the warning signs are helpful. Engaging in a mental health treatment plan instead of just, let's just transition them, can reduce your risk of life-threatening outcomes.
Still affirm somebody without saying, hey, you're going to wait till you're an adult to get this done.
That is the consequence of not letting them access the care. That's what we're trying to get at, is that the consequence is that they will suffer if you don't allow them to access this care that's evidence-based, that they're seeing special.
What percentage? Is it low? Is it very low percentage? Right? Like the ones that become infertile? And again, why didn't the Supreme Court get this evidence? Why? Why didn't the Supreme Court get this? Arden needs to call them. Arden and Jovan, they need to become ACLU lawyers and go to the Supreme Court.
I just want to point out a dissonance here, Casey, that I hope you'll take to heart, like genuinely. When somebody tells me, I want to be kind to everybody, I want to respect everybody, like my goal is to be kind, and they call into a live show to say how bad X is about trans people and that they don't believe trans identity, they'll it's like, that's not kindness, right? It's not kind to say to your face, I'll say whatever you want, but secretly I don't think you're valid. That's not being kind, right? True.
So is Jovan being kind, saying Christianity is terrible? Didn't the caller indicate at the beginning that was offensive? So I guess Jovan doesn't want to be kind to everybody. I don't remember what this guy said earlier about kindness, but it's not always kindness, it's being civil. So that would be the difference. It's being civil.
hate,
You have to hate that race. You have to dislike that race. You have to dislike that sex.
Casey, hate is not, prejudice is not about hate. It's prejudging. You are making value judgments about the person, their identity, the validity of it, whether or not they should access medicine or not. You're making these judgments about a group without actually knowing anything about them or the medical intervention that they're getting, right? So it's not about hating. It's about having an aversion to them or judging them in an unfair way. That's what we're talking about here, right?
No, it's not. Arden is a man that goes into women's spaces. So it's not prejudging them. It's evidence-based, because there are women that do not want Arden in their spaces. So is Arden being kind? Is Arden being civil? Or is it all about Arden? So what have we learned? Jovan thinks there are still months of processing for diagnoses. False. Jovan and Arden think that sperm is not produced in the ball sac. Arden compares gender affirming care to cancer. Jovan is okay being unkind to Christians. Jovan somehow has evidence the ACLU didn't have to present to the Supreme Court. Low percentages don't matter, except when they matter to Jovan and Arden. Thank you so much for watching. I hope you've enjoyed. Let me know if you think I made any errors. If you can demonstrate that, I will correct them, or at least put a disclaimer in the description. I've listed the detransition stories below. Please check them out. It's very heartbreaking to hear these things, especially Chloe Cole, since she was very young. But, listen to these hypocrites who say, why should we listen to you about any of this? When I've demonstrated, why should we listen to them? Please like, share, and subscribe. Thank you.